Today's topic is on injectables and bruising, your chances of bruising, and how you can minimize your chances of bruising, and how we will also help you to minimize the chances of bruising. Bruising at an injection site is a normal reaction to a trauma to your skin, which that is what it is. You've even seen it with your COVID vaccines recently, that you probably ended up getting a bruise. And our job is to educate you in advance to make sure that you minimize your chances of a bruise. We will do our best here in clinic to keep bruising at a minimum, and we will tell you what to do after the treatment to keep bruising at bay. However, I tell all of our clients you will possibly bruise, and it's better to have the expectation that you're going to bruise rather than thinking that you might not bruise, and then you could be a bit cheesed off if you do get a bruise. And I saw this on the consultant clinic recently, very funny. Number one, we do a screening in advance to check to see if you are on any blood thinning medication. If you are on a blood thinner medication, it's very likely that you're going to bruise, and you're going to bruise more than anybody who is not on a blood thinning medication. You're not to go off your blood thinning medication in order to have your injectables, unless your GP or your doctor, your consultant knows about that. But anybody who's on warfarin, you're a better candidate not to actually have injectables done, but aspirin we can handle. However, if you are a client that is on a blood thinner of any sort, you will definitely bruise at each site. So how often does it happen? I don't know. I do nearly 20 injection sites on each cheek, and you might get one or two bruises on each insertion of the needle, but you can wear concealer to hide them. Number two, eliminating alcohol before and after treatment. So alcohol acts as a vasodilator. That means that the blood vessel will dilate, therefore it's easier for the needle to actually nick a blood vessel. And what a bruise is a collection of old blood that's seeped into the cells in the surrounding skin underneath. And it goes through a couple of different colours. It goes bright red, obviously, because it's red at the start. And then as the bruise dissipates, it means that the red cells are actually starting to break down. So alcohol, ideally, even small amounts of alcohol, like a glass of wine or a shot in alcohol, this can trigger a vasodilation and increase your risk of a bruise at each site. So, yeah, stay off the mind just for a day or two. Number three, arnica. I love arnica. We have used arnica in our house since the kids were small, and they're 24 now and 23. But arnica montana, it is, you can buy them in little pillules. You can now, like, they were poo-pooed as being woo-woo at one point, until I used arnica one time when I was having a wisdom tooth taken out, and nobody would have even known, least of all me, and that half my jaw was pulled out the same day. So arnica works. And even chemists are selling it now, so that's why it actually, it's got great credibility. It's not the easiest to get, I have to say, but if you take arnica pillules before and after treatment, you'll minimize your risk of having a bruise. And a lot of injectors swear by bromelain, bromelain is in pineapples, so that keeps inflammation and bruising at bay as well. So it's always worth a try if you can get your hands on it. Number four, ice packs. We love ice packs here in the Aesthetic Clinic in Clonakilty. I use ice packs for all of our clients, depending on the size of the area that the face is being injected. This is our smaller one, so if I was injecting nasolabial folds, I would use a very small ice pack. It's put into a bag to keep it as clean as is possible, and then if you want to take it home, you can. Larger areas, we've got ice packs like these, so the client can actually put it up and take the ice pack home with them. They're sealed. And for smaller areas, we sometimes might cut these up. And these are all disposable, and we get the client to take them home with them. So it is used for numbing before the treatment, which makes it more comfortable. The client uses it continuously. They put it up to this side if I'm injecting this side, and they're waiting for me to go to the other side, so they have a pack in each hand. Number five, avoiding rigorous exercise. So we usually advise that you do not go to the gym and do rigorous exercise like running, etc. for 2 days after the treatment is done, and the day of, and 2 more days afterwards, because that increases blood flow. Therefore, that is going to increase your chances of a bruise. Now, we all know that exercise is amazing for us, but you can walk for those couple of days, ideally not swimming. I don't want you going into the swimming pool, the jacuzzi or the sea for 2 days after the injectables are done, because it also increases your risk of infection on the site. Okay, how do you manage the bruise? So if you are the unfortunate one that gets a bruise, I'd often see friends of mine who've had Botox done, and I know exactly when they've had the Botox because I can see the little bruise on the side. And they're only tiny bruises. Don't feel that you're going to walk out of here and in the next 24 hours look like somebody who's like Mike Tyson or has been in the ring with Mike Tyson. They're tiny little bruises at the insertion site, but if you have a bruise at each of the insertion sites, well then that can actually look rather unsightly. And even though they're very small bruises, they can attract unwanted attention. So concealer, ideally, when I did my training, they had recommended the concealer is not used on your face until 24 hours after the treatment is done. So that would be the following day. You can use concealer and foundation, and that will hide it adequately well, because it's actually quite a mild bruise usually. If you're a big bruiser, that's going to be different. You'll have to manage that differently. And if you're that unfortunate person that actually gets a bigger bruise, which can happen sometimes, not often, when the nasolabial lines are being done, invariably we inject from here up as far as the nose and from here up as far as the middle. So, and the needle is threaded up that nasolabial line, and you can get a larger bruise. So what we recommend in that instance is, timing is of the essence, to be honest. If you don't want your family to know that you've had this work done and next thing all of a sudden you have a bruise, and that you haven't explained as to where you're in, it might be as well to let family know that you're doing something like this. But this one here is a brilliant, it's called Instant Anti-Age Eraser. It's by Rimmel. It's got a little, little sponge on top, and you can actually use this to hide the bruise. Okay, I hope that helps. Before you come to us, we will send you an information pack by return when you actually make any inquiry or when you make a booking. And then 2 or 3 days before your appointment, we send you a pre-treatment information sheet on how to prepare for the treatment and to be able to keep bruising at a minimum. And the day you come, we also send you a follow-up as well to help you to minimise any unwanted side effects to the injectable. And we do our best for you, but we never guarantee, no medic will guarantee that you're not going to bruise. And obviously it's an injectable, it's got to do what it needs to do. And a bruise can take about 5 days to actually dissipate. And the work itself then takes about 2 weeks to settle into your skin. I hope that helps.